Okay? So, the fibrous skeleton, it might help with refilling. We're not going to concern ourselves with that, okay? This, however, we are. So, this is definitely a picture that you can expect for labeling. All right? So let's take a peek at some of this labeling that I want you to be able to do. Okay? First of all, be able to note if you are looking at the anterior or the posterior. The easiest way to do that, which way is the apex pointing? So if you've got it pointing to the left, you're looking at the anterior. Does that make sense? So now, if we are looking at this anterior portion, I definitely want you to know our aorta, our aortic arch. Okay? Put little marks if you need to, or make a list. All right? Superior vena cava, inferior vena cava. Right pulmonary veins, right pulmonary artery. Now, I want to stop right there for a second. I pointed out in pictures and videos and so forth, they usually represent the oxygenated blood in red, deoxygenated in blue. Then, when we looked at the picture showing the systemic circuit, pulmonary circuit was in blue, which is our veins. Systemic circuit, which is our arteries, was in red. All right? Now, what color are pulmonary veins? Red. Why are they red, not blue? Huh? I gotta speak up. Tell them.
It's leaving the heart, it's oxygenated. Coming into the heart.
That's very, but you're definitely on the right path. Okay? If we're thinking, now let's think for a second. The blood that will be returning to my right side, which would be venous, okay, coming into the right side of my heart, we tend to label with the blue. From the right side, it enters into what's going to be my pulmonary trunk, okay? So now, to take the blood from the heart to the lungs, okay, and back, from this right side, we're deoxygenated, but coming back in, meaning a vein, coming back into the heart, we're now oxygenated, okay? And blue, it's basically reversed in the pulmonary circuit from the heart to the lungs, the blue and the red. Because if we've got to leave the heart to go to the lungs, okay, we've got to go by way of the blue. But to come back to the heart, which would be a vein, okay, we're going to come back with the red. So it's actually reversed in that movement from heart to lungs back to the heart.
Is that the only place?
That is the only place. That is the only place. And it is because we've got the movement. Because we've got the very first place, when that blood comes back to the right side of the heart, the very first place it's got to go is the lungs.
So all the veins are leading to the pulmonary artery. Yeah.
From the right side, anything coming in by way of veins, deoxygenated, and then from the right side itself, the only place it'll go to is the pulmonary trunk, which will lead to the lungs. That's the only place the right side of the heart sends any blood.
So I'm like talking about from like the rest of the body. So those veins will lead to there.
It will lead to, now if we think about from the top part of the body, it'll lead to the superior vena cava. Rest of the body, inferior. Whatever comes into the heart, all right, anything, any of that blood coming into the heart on the right side, the only place it goes is to the lungs. Does that make sense? Okay. Which we're going to look at. All right, so definitely know the right atrium, right ventricle, the coronary sulcus, which we're going to get to, which is so cool, okay? Coronary sulcus. The anterior interventricular sulcus, the left ventricle, and the apex. Your left atrium, coronary sinus, like a bulge right here in this vein. Your left ventricle, the posterior interventricular sulcus. Those are the things that I would want you to be able to label on these pictures. And this is just simply the anatomy to the outside of the heart. Okay? But some of it's going to get very important. So if we begin to take a peek, because we're going to be looking like this now, okay? So if you begin to take a peek at your heart model, yes, and you can see that I kind of highlighted that 4 right there, okay? So please, 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 always take 4, 4, 4, 4, 4, 4, 4, okay? So we have the 2 superior atria, 2 inferior ventricles, AV, AV, okay? Atria are termed receiving chambers of blood, because the right atria receives all the blood returned to the heart. The left atria receives all of the blood returned from the lungs. Ventricles eject the blood. In the atria, it was better represented in the picture on these models that we have. Do you see how they're trying to show what looks like a little flappy wing right here? Okay, they're trying to represent like the auricle that exists, all right? So that little flap is called the auricle. The 2 atria, all right? if you look at our model, which is not very great, almost have to put your fingers in between the two atria and feel the wall between them. That is your interatrial septum. Okay, septum for the separation, interatrial because in between the two. In the atria, we have pectinate muscles. They are being better represented on this portion of your model. If you look here, it looks like they have these ridges that they have indented into it. That's representing what is called the pectinate muscle. Okay? Now the ventricles. What do you notice about the amount of myocardium in the atria?
A lot of it.
In the atria? Mm-mm. Nope. Hold up. Do they contract? Oh, yeah. Once again, we're going to be dependent on pressures. Yeah. Now, where do you see a lot of in our ventricles? Okay? Ventricles. These are the pumps. Why? Why is it that when I look at the ventricles that has myocardium, that these are the pumps?
They're bigger.
Why?
Because it's working against gravity, like it has to pump it this way.
We're going to have to push it upward. We're going to have pushing action. But what is special about myocardium?
Cardiac muscle.
It is the only place that has the cardiac muscle. That is the only cell that can do the contraction and the relaxation. This is why this would be considered the pump portion, because these, when that muscle contracts and relaxes, what's going to be happening is that is going to be able to create that twist and push that I tried to represent. Because, yes, we've got to have the pushing action that will propel it upward. Does that make sense? And the only part that can work to do that is the actual cardiac cell. Okay? So, it's separated by an interventricular septum. This one has trabeculae, cardiae, which are going to be internal ridges. And if you kind of tilt a little bit and run your finger, you can kind of encounter some of those ridges, as well as looking at this portion and seeing the ridges. Okay? So the trabeculae, cardiae. On the surface, we're going to find, which I've tried to kind of point out already, okay? Because I got you guys to look where it looks like there's this impression running right here. There's this like impression running right here, all right? And then if you look at atria, they look pretty well separated anyway, vessels and everything, okay? So we have got our boundaries of the 4 chambers. So 1, 2, 3, 4. All right?